Hi, I'm Dr. Michael Hyman with LA Sexual Health. You can visit the website lasexualhealth.com or email info@lasexualhealth.com. Um, I'm talking about vasectomies and trying to demystify some of the rumors that go around, like, it's super painful or it screws up my sexual function, all of which is not true. Really, in terms of the overall discomfort of a vasectomy, I'm going to say it really is on the low end of the spectrum. It's certainly not like a white knuckle procedure, okay? There's a couple of points where you might feel a little bit of a pinch in the skin. You can just take your fingernails and pinch your scrotal skin, and that's kind of what we're talking about. And then just, kind of like having a testicular exam, like moving things around down there. But honestly, it's very, very tolerable. If you're anxious about it, I always offer my patients to take a Valium an hour before. 99% of the time, it is not necessary to be under anesthesia. It certainly can be arranged, though, if that's your preference. But honestly, it's probably going to be more trouble than it's worth. You can just come on in. It takes about 20 minutes, and you literally, if you don't take any sedatives beforehand, you can actually drive yourself home. If you do take some sedative, then your partner or someone else can drive you home. But it's a very simple procedure. And my approach is what's called the no scalpel technique. And that means no cuts, no stitches. It's just a tiny little puncture. We're talking something about that, like basically 2 to 3 millimeters. And both sides can be done through that tiny 2 millimeter puncture. It's made in the midline, halfway down the scrotum, far away from the penis, after an injection with a very, very tiny needle, so you barely feel that needle, that numbs up the skin quite well. And that's basically it. The vas deferens is the tube that goes from your testicles and delivers sperm into the rest of your semen that comes out. And what we do is we basically, through that little puncture, we can access each side, each of those tubes, the vas deferens, which is kind of like a little piece of spaghetti almost, and tie off or ligate or clip that tube in 2 different places, and then remove a segment in between and burn the ends, those little remaining stubs. And that pretty much seals the deal. It's very effective. We're talking 99.9% effective. There's extremely rare reports of spontaneous what we call recanalization, but it's extremely unusual, and there's a lot of ways to prevent that, even that 1 in 10,000 from happening. And so it's a pretty simple procedure. A lot of insurance companies will cover vasectomies, and as far as the postoperative experience and discomfort, what we'll tell you is ice packs the day of the procedure. You can use, a lot of guys use frozen peas. They'll put it underneath the scrotum for like 20 minutes every hour for 3 or 4 hours. And then while I'll tell people not to take Advil, Aleve, ibuprofen, those kinds of medications beforehand, because they can thin your blood, but after the procedure, it's perfectly fine, after 3 or 4 hours, to go ahead and start taking Motrin or ibuprofen every 6 to 8 hours after the procedure for a good 2 to 3 days, and that pretty much prevents any inflammation. I can't remember the last time anybody called me and said that, in the week after their procedure they were aching or had problems. Most people are just fine. Although I do tell folks, gentlemen that are doing the vasectomy, that you really should lay off any kind of heavy lifting or strenuous activity for at least a couple of days. Lastly, you're not immediately sterile after this procedure. You really absolutely have to bring in your semen samples so we can make sure you're sterile. that means 0 sperm. And so we would recommend doing that at about 4 weeks and then at about 8 weeks. Sometimes you have to go a little further because we'll see a few dead sperm and we'll want to have you continue to repeat it until there are none. But that's basically the short version of vasectomies. Again, you can visit the website lasexualhealth.com. I'm also available for online consultations. So reach out, and thanks for watching.